So I'm going to talk about what happens to health coverage when someone returns to work. And I'm going to cover both Medicare and MassHealth. And okay, one thing I want to be clear about is that most of what I'm talking about only applies to people under 65. It only applies to people who are Massachusetts residents. We tend to have much more generous programs here in Massachusetts than many other states do, yes. And I'm focusing on people who are already receiving SSI, SSDI, or both, although some of this applies beyond that.
Is there a PowerPoint that matches this?
Yes, it's being is it? It should be being passed around.
Thank you.
It didn't get here in time to get into the. So first of all, the two programs that we're looking at are MassHealth and Medicare, and this PowerPoint slide up here shows lays out the differences between the two programs. MassHealth is the Medicaid program for the state of Massachusetts. It's administered by the state. For most people, it's a needs-based program, which means it will have income and asset limits. It's available, SSI recipients get MassHealth automatically. MassHealth has a broad scope of what it covers, including community long-term care support, such as personal care attendant services. And there's some aspects of the MassHealth program that are unique to Massachusetts. Medicare, on the other hand, is a federally administered program that is pretty much the same in every state in the country, and you can carry it with you if you move from state to state. It's not a needs-based program. They don't except in how much you pay for premium. SSDI recipients, Social Security recipients, receive Medicare. Medicare is available to elderly people over 65, adults with disabilities, and people with end-stage renal disease. And there are limits on what Medicare covers. Medicare doesn't cover most dental services, doesn't cover eyeglasses, doesn't cover most community long-term care services. Okay. I'll get to that a little bit later. But first I'm going to talk about Medicare, which it doesn't really fit into at all. Okay, so Medicare, a general overview of Medicare. It's a national health insurance program. It's based on a private insurance model where you pay a premium, there's co-payments, co-insurance, there's deductibles. It's administered by the Center for Medicare and Medicaid Services, which is known as CMS. Let's see. And Medicare is broken into different pieces. There's the original Medicare, which is Medicare Part A, covers hospital bills, and some other inpatient services. Medicare Part B, which is called supplementary medical insurance, covers outpatient services. There's something called Medicare C, which is, or also known as Medicare Advantage programs, which is that you can use your A and B to join a managed care program through Medicare. And then Medicare now has a prescription drug benefit, which is called Medicare D. So how are people with disabilities eligible for Medicare? It's not based on income, it's not based on resources, it's based on the fact for most people that you're receiving Social Security disability benefits, and the eligibility begins after 24 months of cash benefits. Some people can get immediate coverage. These are people who have a diagnosis of ALS or end-stage renal disease. And the last point is, and I think a lot of people don't know this, is that people who can't get Social Security disability because they work for the city or they work for the state and they didn't pay into the Social Security system are still nowadays paying into Medicare, and if they become disabled can apply to get Medicare even though they're not on Social Security benefits. So Medicare A, when you're receiving Social Security disability cash benefits, you get Medicare A whether you want it or not. It comes with the benefit, and the only way to stop it would be to stop your cash. Okay. You are not charged a premium if you're receiving Social Security. And it's, as I said before, it's hospital, inpatient rehabilitation, some home health. Okay, Medicare B covers physician services and other outpatient care and generally pays 80%. And if you apply for and begin to receive Social Security disability, you will be enrolled in Part B unless you tell Social Security you don't want it. And there is a monthly premium, which is currently $115, although it's going down to $99 next year, and some people who've been receiving it for a longer period of time pay less. People with higher incomes might pay more. And if you receive MassHealth Standard, Massachusetts enrolls you in Part B and pays the premium for you. But Part B, if you have MassHealth Standard, you're going to get Part B whether you want it or not if you have Medicare. But for other people, they can choose whether to get Part B or not. This thing echoes when I get too close, or can you hear me? Which is better, if I'm close like that, or? Okay. Medicare Part D is the prescription drug coverage. And to receive this, you have to choose a plan, you sign up for it, and you pay a premium. But if you are a dual eligible, which is someone that's receiving a MassHealth benefit as well as Medicare, then MassHealth is going to enroll you and pay the premium if you choose one of the lower cost plans. And if you're a dual eligible, you're allowed to switch plans at any time. Once you have this Medicare drug plan, most drug coverage comes through Medicare and not through MassHealth. So dual eligible is someone who receives both MassHealth and Medicare. So what happens to your Medicare if you're on Social Security and you go back to work or start working? So, and this is sort of building on Svetlana's presentation earlier this morning, because I'm not explaining all the work incentive benefits that go with the cash, but she explained, I believe, what the trial work period is and then the extended period of eligibility. So as long as someone is considered medically disabled by Social Security, as long as you haven't improved, the Medicare coverage will continue for 93 months after the end of the trial work period. And during that period, the Medicare A is available without a premium. It continues to be free. And the Medicare B will continue to be taken out of the Social Security check if you're receiving one, and if you're no longer receiving a cash check, Medicare B gets billed quarterly. No longer, unless you're on MassHealth and they're paying it. So if you're getting billed for Medicare B and you don't pay the bill, the Medicare B terminates. And Medicare, as long as you have Medicare A, you can continue to have B if you pay the premium for it. And you can have C if you have both A and B. So the Medicare A continuing happens pretty automatically, and the only issues with that might be which insurance pays first if you also have insurance through a job. But the Medicare B, as I've said, when someone's no longer receiving a cash Social Security check, you have to pay this quarterly premium or it will terminate. Or you can cancel it because, $115 a month, that's a lot of money and whatever. If you cancel the Medicare B, there are sort of complicated rules and limited times when you can get back into it. And that, I think, so I guess I would recommend that anybody who's thinking of canceling their Medicare B should consult with someone before they do it. And one place you can consult is through Greater Boston Legal Services. We have a Medicare advocacy project. We provide free legal services to Medicare beneficiaries, and we have our brochure in your folder. So if you're someone who's thinking of dropping their B, it would be a good idea to talk to someone first to make sure you'll be able to get back on and see what the consequences are. If you drop B, one time you can get back on is January through March of every year. You can sign up to get back on, but it doesn't start till July 1st. So that can leave you without health insurance. If you're dropping it because you're covered by group insurance based on active employment of your self or spouse, you will be able to get back on as long as you haven't had a gap of more than 8 months. But COBRA coverage does not count as coverage based on active employment. Neither, for example, would the insurance people sometimes get when they're on unemployment benefits, although. So people, I mean, I've certainly had clients in this situation where they drop their B because they have insurance through a job. The job ends, they keep the COBRA because they're in treatment for something or other, and then lo and behold, the COBRA's ending and they can't get back on Medicare B. And it's not a good place to be. Also, when you drop B without other insurance, you end up paying a higher penalty, a premium penalty when you get back on. So one question is, do I need Medicare B if I have, say, for example, common health coverage through MassHealth? Okay, currently common health doesn't require you to take Medicare B, and common health is, in most situations, is not going to pay your B premium. But common health is also not going to cover you if you go outside of Massachusetts most of the time. And you would, with common health, if you wanted to get your B back, you'd be in those limited re-enrollment rules that I just talked about. It doesn't give you a special enrollment period. Okay, do I need Medicare B if I have insurance through a job? Probably not if it's employer-sponsored group insurance based on your current employment. And active employment of yourself, your spouse, or in some cases even a family member. But once again, COBRA, when the job ends or the insurance based on working ends, you need to get back on B then. So you've had this Medicare for 93 months while extended period while working. What happens at the end? Actually, as long as you're considered medically disabled still, you can continue to receive Medicare A, but now you have to pay for it, which it's $450 a month currently for some people, or $248 depending on how much you've worked. And I don't know if I've ever met anybody who's actually paying for the Medicare A after the 93 months. But if you purchase A, you can also purchase B. And then you can purchase D, and you can continue this until you're age 65 when you would be Medicare eligible anyway. And now I'm going to move on to MassHealth. Okay, MassHealth is a series of programs administered by the Massachusetts Executive Office of Health and Human Services, and some of these programs are unique to Massachusetts. The primary programs that affect people with disabilities are MassHealth Standard and MassHealth Common Health, although there are two other public programs that people with disabilities are sometimes on, which one is Commonwealth Care, and the other is the Health Safety Net, which the gentleman in the first row had asked about. And for all of these programs, if you're under age 65, there is no resource limit, but some of them do have income limits. If for someone who receives SSI, there is not a separate application to have MassHealth. You are automatically given MassHealth Standard. Your eligibility is administered by the Social Security Administration. And if your cash SSI terminates due to work, you may still continue your Medicaid under something called 1619B Medicaid. And if your cash SSI terminates and for some reason you're not eligible for that 1619B program, then you should receive an eligibility review form from MassHealth and a termination notice before your MassHealth would terminate. And did Svetlana talk about the 1619B program this morning? Earlier? Okay, no. It was, okay. So, in order to receive 1619B Medicaid, you have to have been on SSI for at least a month. You would still be eligible for cash SSI except for your earnings. So that means that you continue to meet the disability criteria and you meet other SSI eligibility criteria, including the $2,000 asset limit. And the third is that you need Medicaid in order to work, and you have earnings below what they call the threshold amount, which is a fairly high amount, okay? It's the amount that would be needed to replace all of the cash SSI, Medicaid, and publicly funded attendant care services, which is like PCA services. So in 2011, the annual earnings limit to get 1619B Medicaid in Massachusetts is $36,391, or for people who are blind, $37,240. In some situations, if you have impairment-related work expenses, which is misspelled on the slide, blind work expenses, attendant care, other high medical costs, the amount you can earn can even be higher. But remember, this is only for people who've been on cash SSI. The way you access this Medicaid benefit is through being on cash SSI. When you're on 1619B, the eligibility for this benefit is determined by Social Security. So what that means is, even though you're not getting a cash SSI benefit, you have to continue filling out those Social Security SSI review forms, or you're not going to continue getting this Medicaid benefit. And you also have to continue meeting the SSI asset limit of $2,000 in order to continue getting Medicaid in this way. Now, one advantage of being on standard is that this way it pays your Medicare B premium. You're not going to get charged a premium by MassHealth, which you normally would with an income, of $30,000. So it is, but it does require you to, keep your resources low. Okay, if you don't receive SSI, then to receive a MassHealth benefit, you have to apply separately to MassHealth. And MassHealth has this centralized computer system, and there's one application will determine your eligibility for MassHealth, for Commonwealth Care, which is a new program specific to Massachusetts for uninsured people with incomes below a certain poverty, 300% of the poverty level. It was for uninsured adults. And Health Safety Net, which is, Health Safety Net is free care, what used to be called free care, through hospitals and community health centers. And while not that long ago, each hospital had their own free care program that they administered, but now it's all eligibility determined by MassHealth through this same application that also looks at whether you're eligible for MassHealth programs. So, MassHealth Standard is sort of the gold card, I guess. It's a program for SSI recipients. They get it automatically. People receiving SSDI with income below a certain limit get it. The income limit is currently $1,207 a month for a family of one. And there's an income chart in your folder. And People with disabilities who have been determined disabled by MassHealth and have income below that amount can also receive MassHealth standard, whether or not, even if they're not receiving cash SSI. And finally, parents, children, and seniors are placed on MassHealth standard. MassHealth Common Health is a program specific to Massachusetts, and it's available to people with disabilities who work at least 40 hours a month, and the eligibility under this program can continue after age 65. It's also available to people under age 65 who meet a one-time deductible, which I'll explain in a few minutes. And there's a separate MassHealth Common Health program for children with severe disabilities whose families have too much money for them to be on regular MassHealth. So there are these three MassHealth Common Health programs. Okay, for the deductible program, this is the program you could be eligible for if you have a disability, like you're on Social Security or MassHealth has found you to meet their criteria. Your income is above 133% of the poverty level, and you're not working the 40 hours a month. You're working less than that, or here's how the deductible is calculated. Okay, so let's say you have income of $1,500 a month. They use an income standard for a family of one of $542. They would say you have excess income of $958, and they would give you this deductible down there of $5,748, which is a pretty big deductible for being like this person was less than $300 over the MassHealth income limit. So you have this deductible. What do? You can meet your deductible. You could work 40 hours a month and also get Common Health. In some situations, you can get Commonwealth Care. That would be if you didn't have Medicare or any other insurance and had income below 300% of the poverty level. You could get this Commonwealth Care program, which isn't quite as comprehensive, but it's not bad. Or you can be on Health Safety Net. How do you meet the deductible? The notice about the deductible will give you a 6-month deductible period, and you have to present medical bills that equal the amount of that deductible and that aren't being paid by any other insurance. So this example I gave, the person would have to come up with $5,000, $5,000 something in medical bills, and MassHealth wouldn't pay those bills, but once you presented them, you would be on MassHealth Common Health, and you could stay on until you turned 65 or they changed the rules. And the kinds of things you can use to meet a deductible are broader than what might normally be considered medical bills. They can include remedial services or things like a van modification, dental care that MassHealth wouldn't pay for. If you are paying health insurance, they'll give you credit for 6 months of premiums all at once. But okay, you look at the $5,000, you're not going to meet the deductible. One thing is always to check that they've calculated it correctly, or to get advice about that, to make sure they're not counting income they shouldn't count. And if you've ever met this deductible in the past, you shouldn't be asked to meet it again, even if you went off temporarily. But you can meet, people who are working can become eligible for Common Health without meeting a deductible. MassHealth requires that you be employed at least 40 hours per month or 240 hours in the past 6 months. The employment can be self-employment, but they would want it to be an activity that you're spending at least 40 hours a month in. And you can earn less, whoever's employing you does not have to pay minimum wage. Although, obviously, you'd rather earn minimum wage, but people sometimes have more informal kinds of employment. There's a sliding scale premium. There's no upper income limit. You can stay on Common Health. You know, you can earn $100,000 a year and stay on Common Health, although your premium will go up quite high. And if you lose your job, you have 3 months to find a new job before you would lose the Common Health coverage. I mean, or depending on what happens with your income, you might be eligible for something else. What is needed to document, what does MassHealth want in order to know that you're working? They would either want pay stubs, like 2 pay stubs that clearly show the number of hours you're working, or a letter from the employer that says you're working so many hours a month and this is what you're earning. And once again, they don't care whether you're earning minimum wage or not. It could be like a stipend kind of, you know, situation, a job training situation, as long as you're working and getting paid something. The premium is charged on a sliding scale. If you don't pay your premium, you get terminated. There's like if it's 60 days late, you're going to get an advance notice of termination and a right to appeal this. They also have, MassHealth also has a provision that you can request a payment plan if premiums are overdue, or there's something they call a hardship waiver for extreme financial hardship, and there is actually the form to request that in the materials. It would include things like, you know, having your house foreclosed, or being evicted, or having shut-off notices on utilities, or certain other unexpected life, you know, necessary expenses that have been incurred. 5 minutes till questions? Oop, I think I'm almost done. Oh. Good. Okay, this isn't really, this is just to do with MassHealth, Health Safety Net, Commonwealth Care in general. Everybody's eligibility gets reviewed annually, working, not working, and it is very important to return your eligibility if you do not return it, your benefits will be terminated. But I also want to advise people that if you get a termination notice that says you didn't return your review form, and you think, but I did, I mailed it in last week, appeal anyway. Because they have been, there's been a lot of issues with, you're laughing. What? No, forms get lost, things happen, you know, they say they didn't receive it when you know you sent it, or they say they mailed it to you and you never got it. If you appeal the termination notice before the termination date, your benefits will continue until a hearing is held, and if generally you'll get a phone call before then, and if they have it and it's all worked out, you don't have to have a hearing. But if you do not appeal and your benefits stop and there's like a gap in your coverage, it can be very difficult to close that gap. And depending on what kind of health needs you have, you can end up with, you know, things not being covered. Like, gee, because once you get terminated and you send something in, they're not going to process it for 6 weeks. So it really is better, when in doubt, appeal, and you can always cancel the appeal, and you're going to stop me, right? Okay, this is my last thing. I just wanted to say sort of a word of caution about all this, which is that public programs can always change. You know, they change the law. And especially now with what's happening federally, we really don't know what Massachusetts programs are going to look like in the future. Common Health is a Massachusetts-only program, so it doesn't pay out of state, and if you move out of state, you won't have it. And finally, you know, get advice about your specific situation, because everybody's situation is different.